Hand hygiene has been performed and will be performed again before I touch the patient. Hi, my name is Jessica McCray, and I'm going to be your student nurse practitioner today. Can you tell me who you are?
My name is Lee Mark McCray.
Lee Mark, can you tell me how old you are?
I'm 35.
35?
Mm-hmm.
And what brings you in today, Lee Mark?
I have a cough.
A cough? Oh, I'm sad to hear that. When did this cough first start?
About 3 days ago.
3 days ago? Oh. And how frequently have you been coughing?
A couple times an hour.
A couple times in an hour?
Mm-hmm.
Okay. And how long does the cough last once you start coughing?
Sometimes maybe a minute.
A minute? Okay. And can you describe that cough to me?
It's dry cough.
Dry cough. Does it produce any flame? Spitting up anything? Okay. Is it anything that helps the cough feel better?
I've been taking Vicks cough syrup.
Okay. And when was your last dose of that?
About 3 hours ago.
3 hours ago? And how often have you been taking the Vicks?
Every 4 hours.
Every 4 hours? Okay. And is it anything that makes the cough worse?
No.
No? Okay. Are you having like any nasal symptoms? Like drainage? Any nasal drainage, congestion?
No.
Any headache, dizziness?
No.
Any fever or chills?
No.
Okay. What about any breathing issues? Any shortness of breath?
No.
Chest pain?
No.
Chest tightness?
No.
Okay. Any sore throat?
No.
Okay. Any earaches?
No.
Okay. And just to ask you about other body parts, are you having any problems with peeing and pooping?
No.
Okay. And are you having any muscle weakness or any musculoskeletal issues?
No.
Okay. Is anyone else in your house been sick?
No.
Okay. Great. Are you allergic to anything that you know of?
Yes. Mold, dust, and pet dander.
Mold, dust, and pet dander. And can you tell me what that does to you?
It had me coughing and sneezing.
Okay. Are you allergic to any other medications or any foods?
No.
Okay. And you're not allergic to latex or any
No.
bananas or anything?
No.
Okay, great. And have you been around any of those allergens that may have triggered this cough?
No.
Okay. Do you take any other medications other than the Vicks?
Yes, I have them listed here.
Okay. Oh. Triaterine, HCTC 37.5 for 225 milligrams. Okay, and you take this daily?
Yes.
Okay, and do you take it in the morning or afternoon?
In the morning.
Okay, great, because it has a water pill in it. You definitely want to take it in the morning. That way, as it makes you urinate throughout the day instead of being up all night urinating. And I see you on albuterol. You have asthma?
Yes.
Okay. Tell me a little bit about this asthma. When were you first diagnosed with asthma?
About 7 months ago.
7 months ago. And when was your last asthma flare?
About 5 months ago.
5 months ago. And have you had to use asthma for this cough any? I mean, albuterol for this cough any, sorry?
No.
Okay. And your blood pressure, when were you first diagnosed with that?
A year ago.
A year ago. And do you check your blood pressures daily or often?
Often, like every other day.
Okay, great. What have your numbers been running?
120s, over 80s.
Okay.
Around that.
Sounds pretty controlled. And so back to your asthma. You said 7 months ago you were diagnosed, and then you had another flare after your, which was 2 months after your initial diagnosis, and you have not had any issues with it since.
No.
Do you smoke?
No.
Okay. Do you drink?
No.
Okay. Do you take any drugs, such as Percocets?
No.
Okay. And do you use any other drugs such as marijuana, cocaine?
No.
Okay, great. Tell me a little bit about your family, mom, dad, siblings. Does anybody have high blood pressure, hypertension?
Mom and dad has mild hypertension. I have a brother who's diabetic, and he controls his diabetes by his diet.
everybody's pretty much under control. So your blood pressure medicines, you told me that you run around 120s over 80s. And are you good with medications?
I need a refill on my prescription.
Okay, on both of them?
Yes.
Okay, great. So before I do anything else, what I'm going to do is I'm going to assess you, and I'm going to start at your head and just move my way down to your feet. And I'm going to be asking you to do certain things to help assist me with this assessment, okay?
Okay.
Is it okay with you if I move forward with this?
Yes.
Okay, great. I'm going to clean my hands. I'm going to move this chair out my way so that we can have more room. That's okay with you? I'm just going to start at your head. And I'm just feeling for any nodules in your head, any masses. And no nodules noted. Moving on to his external ear. No obstructions noted. Is there any tenderness?
No.
Okay. No obstructions noted to this side, and any tenderness?
No.
Okay, while I'm here, I'm going to perform the whisper test, which will be cranial nerve number 8. I'm going to whisper something into your ear, and I want you to repeat after me what I say, okay?
Apples. Yellow.
Okay, great. While I'm here, I'm also going to assess the lymph nodes, starting with the preauricular, moving on to postauricular, occipital, tonsillar, submandibular, submental, cervical chains, supraclavicular, and no lymph nodes were palpated. I'll be moving on to your frontal sinuses. I'm just going to palpate your frontal sinuses. Let me know if you feel any tenderness, okay?
Okay.
Any tenderness?
No.
Okay. Any tenderness?
No.
Okay, great. Moving on to your eyes. I'm going to assess cranial nerve number 2. Can you first of all cover your eye for me? And can you tell me what line you can see?
LTFPH.
Okay. And can you cover your other eye for me? And what line can you read?
LTFPH.
Okay. Great. That was cranial nerve number 2. Moving on. Still looking at cranial nerve number 2. I'm just going to shine a light into your eye. Pupils equal, round, and reactive to light. Alright, so now I am going to get you to follow my fingers with your eyes. This is just to check your eye movements. So start here. Great. Alright, accommodation noted. Cranial nerves 3, 4, and 6 are intact. Moving on to cranial nerve 5. And what I'm going to do is let you feel this. This will be your dull. This will be your soft. So I'm just going to touch your face in several spots, and you're going to tell me if it's dull or if it's soft, okay? Can you close your eyes for me?
So.
Cranial nerve number 5 is intact. Moving on to cranial nerve number 1. Well, I'm not assessing 1 yet, but I will look into his both nostrils, and the mucosa in his nostrils are pink and moist. I see some clear drainage. Alright, can you obstruct 1 nostril? And I'm going to put a fragrance under your nose. Can you tell me what you smell?
Coffee.
Okay, and can you do the same with the the other side.
Coffee.
Great. And I also forgot to mention that his conjunctiva of his eyes were white. His conjunctiva was pink and moist, but his sclera was white. Sorry. All right, and cranial nerve number 1 was intact. It was just the olfactory nerve. The patient could smell the coffee in both nostrils. Now moving on to TMJ. Can you open your jaw for me? All right, can you close? I did not feel any clicking in the jaw. Did you have any tenderness or any pain?
No.
Okay, great. Moving on to cranial nerve number 7. Can you smile for me? Can you puff out your cheeks? And can you frown? Okay, good. Can you open your mouth for me? Can you say, ah? And the uvula, which is cranial nerve 9, is midline. His oral mucosa is pink and moist, no redness noted to the tonsils. All right, assessing cranial nerve 10. Okay, cranial nerve 10 is, which is the gag reflex, is intact. Also, no dental caries noted to the teeth. Can you stick your tongue out? Can you move your tongue from side to side? Can you lift your tongue up? And now down. Cranial nerve 12 is intact. Now moving on to cranial nerve 11, checking the sternocleidomastoid and trapezius muscle, or the accessories to the spine. I'm going to put my hand on your face and you're going to resist. Okay? It's cranial nerve 11. And can you push up? Wonderful. Alrighty, moving on to your neck. I am looking for any rashes. No rashes noted. Also going to feel the carotid arteries. You would never palpate the carotid arteries simultaneously. Carotid artery is palpable. I'm just going to come behind you to assess your thyroid. Can you swallow for me? Can you turn your head to the left? Swallow. Can you turn your head to the right? Swallow. Alright, no goiters, no masses or nodules noted to the thyroid. I'm just going to take my stethoscope and I'm going to listen with my bell for any bruise. No bruise noted. Now I'm going to listen to heart sounds with my diaphragm of my stethoscope, starting at the second intercostal space. Second intercostal space, right sternal border for my aorta. Second intercostal space, left sternal border, my pulmonic valve. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. And can I come under your shirt for this one?
Mm-hmm.
Fifth intercostal space, mid-clavicular line. It will be my mitral valve. I will listen at my mitral valve for 1 full minute to assess the apical. And now I'm going to flip my bell, which I have already done. And I'm going to move in that same order to assess for murmurs this time, starting at my aorta. pulmonic, herbs, tricuspid, mitral. No murmurs noted. Now I'm just going to feel your pulses, starting with my brachial. Down to my radial. Popliteal. And this popliteal. Left. And both my dorsalis pubis. All pulses are palpable and are 2+. Now I'm going to check your reflexes. Starting with my brachial. Trapezius. Brachioradialis. Tella. Sit back from. Achilles. Moving on to my lungs, I'm going to listen, starting at my anterior. Each time I move my stethoscope, can you take a deep breath for me? Deep breath. 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 And a deep breath. Lung sounds are clear anteriorly. Deep breath for me. 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 Okay. Okay, so every time I move my hands, can you say the word 99? 99?
99.
99?
99.
99?
99.
99.
99.
And that was to assess tactile firmness. Can you just take a deep breath for me and let it go? Chest expansion symmetrical. Lung sounds posteriorly were also clear to auscultate. I'm just going to ask you, can you just turn this way for just a second? I'm just going to percuss on your back. Resonance noted. Okay, okay. Can you do one favor? Can you squeeze my fingers for me? Okay, great. And let's see. Capillary refill is less than 3 seconds. Capillary refill is less than 3 seconds. All right, can you lie back now and let me assess your abdomen? Okay. All right, so I'm looking for any scarring or any rashes, of course, as I would on all parts of the skin. So far, I see no rashes. His skin is normal for his ethnicity. And just inspecting. Now I'm going to listen or auscultate, starting at my right lower quadrant and advancing all the way through all 4 quadrants. Listening for vowel sounds with my diaphragm. Right lower quadrant. Normal vowel sounds. Right upper quadrant. Normal vowel sounds. Left upper quadrant. Normal vowel sounds. And left lower quadrant. Normal vowel sounds. I'm going to assess your aorta and your renal arteries, listening with my bell. Aorta. No bruit noted. Renal artery, right side. Renal artery, left side. Iliac, left side. Iliac, right side. And my inguinal. Sorry. And no bruits noted in any of the arteries. Okay, so next I'm just going to percuss on your belly. It's just going to be a little tapping, okay? Let me know if anything feels uncomfortable. And tympanic sounds noted in all 4 quadrants. Now I will assess for liver scan. And what I'm going to do is start next to my umbilicus on my right side and work my way up. So I'm just stove right there. I'm going to start at my nipple line and work my way down. And when the sound changes from resonance, stop here and swing here. Normally I would mark these areas and I would use some form of measurement to measure. A normal measurement should be between 6 to 12 centimeters, and that will be normal liver span. Now I'm just going to lightly touch on your stomach, okay?
Okay.
And I'm feeling for any masses or any discomfort that you may have. Just testing the waters before. Now I'm just going to press a little harder. Good. No masses felt. Okay. All right, you can sit back up for me. Okay, so now I'm going to get you to touch my finger in your nose as fast as you can. Okay, great. Now take your heel and rub it down your shin, both sides. Great. And that was to assess the cerebellum. All right, you want to place an object in your hand, and I want you to tell me if you can identify the object. Can you close your eyes for me? Okay. Hold out a hand. Can you tell me what that is?
A quarter.
Okay. And can you hold out your other hand? I'm going to draw an object in this hand. Can you tell me what this is?
Circle.
Okay, great. All right, so can you stand for me at this point? All right, can you stand here in front of the camera? All right, and can you extend your arms like this? All right. All right, so So that is to assess pronatal drift. And you can put your arms out. All right, so, which was negative. All right, can you close your eyes for me? And this is to assess Romberg. If it was a positive test, the patient would be swaying, which this patient is obviously not. So Romberg is negative. Okay. So can you now, at this point, open your eyes? Can you move your head side to side? Okay. Can you roll your head all the way around? All right. Can you lift your arms? Can you put your arms out like this? Can you put your can you raise your wrist? All right. Now, can you lift your leg? Okay. And can you lift this leg? Okay. Now, can you walk on your tippy toes towards the camera? Okay. Can you walk back heel toe? Okay. Now, can you walk back on your heels like this? Okay, great. Now, I've got to do one last test, and that's the Bembinski sign. I've got to touch the bottom of your feet. All right. Can you put your foot here so I can really see it? There we go. Okay, great. Alrighty, so I'm going to step out and let you get yourself together, and then I will come back in, and then we'll go over your medications and get you all set for your refills, okay?
Okay.
All right, thank you for your time.
All right.